Yeah, here we go. We're now recording. So if you could please, as I said, note your questions in the chat as they come to you, and my colleagues are going to keep an eye on the chat. So we're going to get started. I'm going to first introduce you to the speakers and their respective organizations. We're going to start with Grow ECD, which is a nonprofit early learning enterprise that empowers ECD center owners in underserved areas of South Africa to deliver quality early learning programs. It provides centers with the digital tools, training resources, and financing required to improve child outcomes and make ECD centers more sustainable. Zani Lamb, who we'll hear from today, joined the Taking Care of Business Group, which includes Grow ECD, in 2023 as the M&E lead, and she brings nearly 20 years of experience in monitoring and evaluation to her role. Zani envisions sustainable, high-quality ECD centers across South Africa that are safe, joyful spaces where every child builds skills for future successes. So we're going to hand over to you now, Zani, and I'll introduce Kitso just before her presentation.
Awesome. Thank you so much, Jessica and the Data Drive team for having me. I'm just going to quickly. Fantastic. So can you see my screen?
Not yet, Zani.
Okay. Okay. There we go. That's better, right?
Yes, perfect. Thank you.
Fantastic. Thank you so much, Jessica and the Data Drive team. It's always lovely to talk about M&E, and it's wonderful for us as well as the Grow ECD team to share today about how we've started to embed the ELOM 4 to 5 assessment into our impact measurement framework. And I just want to start off by saying we're still very much in early stages, so I'm very much going to focus on why we decided to include the tool in our IMF, some of our learnings so far, and where we envision going with this tool. So some of you might be familiar with Grow ECD, but basically, and I'm just going to speak to our theory of change today. I'll leave the programmatic at the end of the presentation. I'll give you links to some of my colleagues that would be able to tell you more about our programs in detail. But if you look at the Grow ECD theory of change, we believe that each child in South Africa should have access to quality early learning in the community where they are based. And we drive this quality early learning by improving the learning environment and ensuring that the ECD center is sustainable. We do this through 4 programmatic interventions that you can see there, and combine this feeds into our very gorgeous, very complex theory of change. If you look at our theory of change, and I'm not, just in the interest of time, going to go into each component, I'm just going to focus on measurement for today. If you look at the theory of change, you can see we measure across 36 months. Our biggest impact occurs in the first 24 months. So that's where we see our biggest program effects. So that would be the area below the orange line. And as Jessica mentioned earlier, Grow ECD forms part of the TCB group, so we're very fortunate in that we can often share learnings between the groups. And something that we saw in TCB was the value of having sector-specific national longitudinal data that we can help to measure and understand our program effect, and also to help us to just better understand different dynamics within our program implementation. Is something happening because it is a program, like programmatic? Is it environmental? Whatever reasons. And when we started in 2023 looking at how we can better strengthen our impact measurement framework to measure this theory of change, we knew that we wanted to include, and we wanted to start building similar longitudinal data for Grow ECD, and we wanted to do it around, if you can see here at the bottom, whether or not at the top, whether or not learners are great already. So we looked at various tools, and the ELOM 4 to 5 assessment, without a doubt, became the premier tool that we felt would be the most effective in measuring this outcome, but also because it was, for various reasons that we know why it's also used in the 5x5. It's nationally validated, it's comparable, it's tested, all of those reasons. And then we proceeded and we thought, we're just going to do what we did at TCB, and we started off and we tried to pressure, like kind of to use the tool within these first 24 months as part of our monitoring group of tools, and then at the same time building longitudinal data. It did not work out as we planned, and that's for various reasons. I think first and foremost is the tool wasn't designed to be a monitoring tool. If you are looking at monitoring your program effect and you're doing it at this like kind of very intense period, you want a tool that is going to be that your team can use easily at regular intervals, it's cost effective, and it's at center level. And unfortunately, we couldn't with how our program is structured. It might work in your instance, it didn't work for us. For example, our ECD centers, most centers do not have 15 or more learners that are 4 to 5 years of age, which meant we couldn't assess and at center level, which was one of the main things we wanted to do. So we went back to the drawing board and we went, okay, well, it didn't work for what our intended purpose. And we much debated whether or not we should look at a different tool. But ultimately, because of the value that we saw in the 4 to 5 assessment, we rather decided to re-look at how we measure and where we use the ELOM 4 to 5 assessment in our impact measurement framework. And the decision was taken to use it here above the orange line at what we call our long-term outcomes level. So if you look at this indicator, I'm not sure if you can see my cursor, but if you look at learners are developmentally on track and learners are great already, you can immediately go, oh, well, those are very closely aligned, but we measure these differently. So below the orange line, as we said, program data. In this instance, we're using our learner assessment tool. We're working with JET at the moment to refine that quite a bit. And we do this through empowerment evaluation. It's done at center level. Our teams own the data. And then we use the ELOM assessment above the orange line as a validation to ensure that another form of quality control, that what we measure here and the outcomes we achieve here and what our data says here is corroborated externally. We had our first dipstick report in this new IMF structure last year, and our intention is now going forward to use it maximum 3 years to retest, less if needed. And what we are going to do, because we're an MPO and we want to make each 1 Rand do 5 Rands worth of work, is we won't just be repeating the dipstick at regular intervals. We will be including this in an external evaluation every time, which will take a different format depending on the needs of the program to test various components of this theory of change. And the value of that for us in embedding the tool in our impact measurement framework is, it becomes familiar to our teams. It becomes another tool. The team really understands how to use it. We start building our longitudinal data, and also we can control costs. So something I was fortunate to attend one of the in-person sessions with Data Drive, and cost came up a lot in the discussions. If you know it's going to happen, you kind of build it into your budget already, but also, as we know, external evaluations become costly if you do not have the right data, because you have to go and collect data, you have to go clean data, or you have to pay statisticians to make the data work. If you know in 2 years, so we're already planning now for 2 years from now, we can ensure that we collect what will be needed for that evaluation. Also, we are working with our different branches in terms of how they themselves monitor the theory of change and their own work in driving these different causal pathways, which means in terms of communication, when we do get the evaluation findings, it is not coming in from the cold to the teams. They're familiar with the ELOM 4 to 5 assessment. They know how it works. They're familiar with the causal pathways. They can anticipate what the evaluation will say. So one engages in a much more constructive and immediately programmatically focused discussion than just coming in from the cold. So in summary, since I just have 10 minutes, I'm just quickly going to summarize why I say we integrated it because we see the value of the tool. We see the value of having longitudinal data that is nationally comparable. We wanted to make sure that our teams are familiar with the tool, and we wanted to normalize its use. It is not something government just comes on regular intervals and maybe tests at your center. It is a tool in our kit. And also we see the tool as something that enables us to measure quality while building longitudinal data. And it gives us some flexibility to evaluate. There's some very interesting evaluations that have been done using the tool. We also believe that like kind of by embedding this in our system, knowing that it is going to happen, enables us to control costs to a certain extent. And also we see its value in the theory of change, and we see the value of already now starting to work with our teams to better understand the tool and to normalize the tool in our organization. And if you are thinking of including the ELOM tool 4 to 5 assessment or any of the tools, I do strongly recommend not doing what we did and like kind of making a lot of assumptions about what the tool can and can't do. I think many organizations have gone before us, and the Data Drive team knows those lessons that the organizations have learned and are very open to discussing what can and can't be done, how it can be done, and what is practical. And then, yeah, that is all. Then you can. So we're looking forward to our journey. We're sure we are going to learn more, and we will be walking alongside the Data Drive team to do it. And we're happy to share after our next evaluation again how the process has changed for us from our first data point, which is our dipstick report, to the next evaluation that we hope to conduct in the next 2 years. And if you want to know more about Grow ECD, these are my colleagues that you can get in touch with, and a QR code to our website. And I did that in less than 10 minutes. Hey, Jess. Yes.
Thank you, Zani. Thank you so much. Yeah, I don't want to put too much pressure on you, but well done. That was a really, really interesting presentation, and it's really amazing to hear those kinds of hard-won lessons learned that yeah, so that other people don't have to maybe go through the
Yeah.
same hardships that you did. And I'm sure there'll be lots of questions, hopefully, and at the end where we can really like get into the nitty-gritty of how you learned those lessons and how you can apply them. So we're going to move on now to Kitso and LETCEE. So a bit of a background to our next speaker. LETCEE is an ECD MPO based in KZN, focusing on early childhood development with integrated programs that target early learning, health, and nutrition. And these programs include practitioner training, both center and non-center based programming, food gardens, and toy libraries. And Kitso Maragelo is the Director of Integrated ECD Projects at LETCEE, and she's been with LETCEE for 12 years. Kitso's biggest goal is to see every child reach through quality ECD services. Kitso, I'm going to hand over to you now.
Thank you. Jess, am I on share mode?
Yes. If you could just go into presentation mode. There we go. But we're not on the first slide. Yeah. Okay, great. Perfect.
Good morning, everyone. Kitso Maragelo from LETCEE. As Jess was explaining, that LETCEE is an organization with a focus on early childhood development, working precisely to provide playful early learning experiences for young South African children who do not really have access to ECD services. So we use an integrated approach to implement our programs. But for the sake of this presentation, I'm just going to focus on 3 programs, which is the NQF level 4 play groups and ECD centers, because that is where we actually conducted our deep study on. So we have an NQF level 4 ECD training for our practitioners who will then, once qualified, establish play groups or ECD centers. And through that, then we provide integrated programs and activities to ensure that we have a holistic development to the child, of the child. I think what is important for us for establishing the ELOM study and the gaps that we actually identified in our M&E study, I would start by saying for us it was important to be able to track school readiness for our 4 and 5 year children that are actually transiting to grade R. And we did that by a deep stick study last year, implementing it with the play groups and also in our centers. So one of the things that was really a concern for us over the years was that we mainly focus on practitioner self-assessment, and in most cases, one would agree that self-assessment have potential for bias. So we needed something that would actually that we would be able to compare with the self-assessment reports from our practitioners, whether our kids are on track or our kids are actually falling behind. And that was our biggest gap in our M&E system. Though we are also using quite a lot of quality assessments of our program, our practitioners, we also look at quality reporting tools on child progress from time to time. But self-assessment, practitioner self-assessment of kids was still a concern for us. Hence, we have to attend to that gap by conducting the dipstick last year. So one would then be able to ask as to why would we then want to embed it in our M&E system, or what was the biggest reason behind that? Realizing that the ELOM tools are in the position to provide evidence-based data. We are able to track impact and also track readiness with through that study. And through it, we were able to actually align our program activities. We were able to identify issues such as patterns, trends, but most importantly, which is something that we really picked out of the study, was being able to strengthen our accountability and also be able to improve our program. That was two of the biggest things that we really see the importance of embedding the ELOM into our M&E system. Lessons, I don't know what happened. Lessons out of this study for us was a deeper understanding of child development. And also something that really stood out for us was the importance of individualization, realizing that each and every child, as much as they can be 20 in a classroom, each and every child is very unique, learn at their own pace, and have got different needs. So those were the things that we really we were able to pick, and we were able to focus on as we progress with our program. And then also importantly was a focus on developmental milestones. Using the ELOM study, one of the things that we also picked was being able to know that each developmental domain, children perform or perform differently on, and with the support that our program offers, children are actually able to thrive. So I think on those things, those a few lessons for us, it was very important. But I think on the communication side, giving feedback to our practitioners, giving feedback to our parents or our families for our kids, it was very important because it also fed into our professional development program for our practitioners. So both the practitioners and our families were able to know as to how the kids are actually performing. A sneak peek into our results was very interesting, not very different from our practitioner self-assessment, but because across all the domains, children were actually performing very well, and I would say they are actually on track, except for the fine motor coordination and visual integration, where a significant percentage of our children that participated on the study were actually on track. And that on its own has made us to go back and look at striking a balance across all the domains from the beginning of the year until at the end of the year, or until when the child actually exits the program, being able to track performance quarterly for each of the domains. So for us, ELOM has actually made us really to be able to improve on that quite a lot. Using the result and desired change, we are able to set clear developmental goals for our children, designing tailored activities, especially for areas where our kids were not performing. I just made an example with fine motor and coordination, where a significant percentage of our kids were not really on track. So through the ELOM, we were able to make those changes, also look into instruction models that we are using, also focus on professional development so that our practitioners would know that there is a need to improve continuously and all that. But I think what most importantly for us was to learn also that a one-size-fits-all approach is not necessarily best, where you would think that because you're teaching children to count 1 to 5, everyone will be able to count 1 to 5. But it was also important for us to learn to develop personalized learning plans that would address specific strengths and areas for improvement. And that was a biggest highlight for us. And I think we really appreciate such things, because sometimes we continue with implementing programs without even realizing that we are actually not being able to measure the impact of our programs. Enablers and challenges to the process. I would say for us, we really had an early preparation, and the fact that ELOM tools are standardized, it was a bonus for us. We didn't have to run around look for tools that we have to establish and all that, but that was actually very important. And also capacity building, because our assessors are trained on how to use the tools. It was actually very important, and it has made the process quite easy. However, on the side of challenges, We had quite a number of issues when it comes to our sample size, characteristics, and the timing. We looked at across 75 to 80 kids. But some of the things we actually overlooked, such as gender, where you would find there were many boys and less girls in the sample, that making it very, very difficult to actually analyze the data. But we appreciate the efforts that ELOM or Data Drive actually made to ensure that our data results actually came back very positive. And then resource limitations for us is another thing. We are using internal assessors. Just like I was saying with the practitioner's self-assessment, our assessors are LETCEE employees, and we're looking into that as to how can we best change it so that in the future we have external assessors to evaluate our program. Time constraints was another challenge because as much as the sample was small, our areas are very far to travel to. So and the weather at the same time was not very good on our side. So we have to really rush everything to ensure that our study was complete on time. I would say for our future users and our current users, when you use the ELOM results to evaluate the effectiveness of your program, be able to identify trends, look for strengths, but I think most importantly, ensure that your program can make a difference. That is the most important, and be able to understand how the tools are used, how you can actually interpret the data. That is the most important thing. Wrapping up, for me, I think I'm just thinking loud. If we were to include parents and caregivers input into the data, it would be something very interesting to see how it would actually complement the results when we continue to do the ELOM study. So for our future plans is to actually do a pre and post a study based on the improvements that we have already put in place so far. With that, thank you so much, Jess.
Thank you. Thank you so much, Kitso. That was it's really helpful to have a first-person account of how these studies are done and how they're integrated into overall program management. Thank you so much for the people who've posted questions in the chat. If anyone else has any questions, please do post them now. We'll start. I think Jennifer had the first question. So Jennifer, if you can unmute yourself and very briefly ask your question. Thank you.
Thank you, Jessica. I think my questions have been answered in the chat. So I'm good. Thank you so much.
Okay. I saw a question there from Niradzo from Breadline as well, and I know Zani did attend to some details in the question, but I'd still love if you could ask Niradzo, because I think particularly your question around the theory of change is really interesting, and I'm sure everyone would like to hear Zani's answer there.
Okay, yeah. Morning, everyone. I think thank you both for your presentation. I think with Grow ECD's slides, just looking at the theory of change, it was just interesting for me just to, just to unpick and understand, like, just looking at the long-term outcomes that they've got and the impact there. Did ELOM tick all those boxes? Were you able, like, how do the ELOM findings compare to the, outcomes that you've got in the theory of change? I think it's a different approach that you used, because it was really great seeing your theory of change, but, just looking at, what did you achieve with ELOM, right? And I think, yes, I also saw the link that you shared. I've also shared with the team, internally with the team that I work with, so that they can also kind of like look at, how that compare with Thrive by 5 results. And then, I also want to find out, right, these terms, the terminology that is being used here with the ELOM findings are quite scientific, right? And it's better to, you understand them if you've got like a monitoring and evaluation background or project management. But how do the parents themselves, because the parents also need to know how are the children performing? So how do you unpack and simplify gross motor, fine motor skills and all these things? And how do the parents actually perceive or take or process the results? I think those are the two questions in the that I've got. And the second question actually applies to both LETCEE and Grow ECD. Thank you, guys.
Okay. That's quite a bit. So let me first start off with our theory of change. As I initially said, is we do believe at Grow ECD that like what underpins our theory of change is that the driver of quality ECD is improvement in the like kind of learning environment, and it is sustainable centers. And if you move through our theory of change, we measure the effect of that improved learning center, of the improved learning environment, by seeing what impact that improved learning environment has on the learner. And we ideally want to see that the learner improves its developmental outcomes. And the developmental outcomes we found, so DartDrive has like a whole host of tools. We found that the ELOM 4 to 5 assessment tool and that is the one that is being used in 5 by 5 as well, was the most effective to measure that specific outcome. So for us, it was a very good alignment as to what we believe our theory of change should achieve and what it measures, which is why we initially tried to include it in our monitoring and evaluation. But as I said in the previous, one of the other questions as well, is that you can't use the ELOM 4 to 5 assessment on a sample that's less than 15 because it doesn't have the same scientific power. So we, at that, like kind of at center level, we use our learner assessment tools, and this kind of gets to the parents as well. So we are busy with JET Education refining our learner assessment tool, where we monitor each child individually, and then we look at the collective results of the group to see how to measure center level of performance. And to our parents, we communicate the findings from the learner assessment tools. So that's like kind of, we have a little bit of a different kind of relationship with centers than some other organizations. So we do communicate the overall findings to the center owners. But I think in terms of the impact for the parent of the child, it is very much coming through the learner assessment tool, which is that block just below where we go and assess on the ELOM assessment tool. In comparison to 5 by 5, so as I mentioned also in my presentation, what we are working towards is building longitudinal data, right? And once you have that, you can see the nuances within your own program, how fluctuations happened at center level, at regional level, at provincial level, all of that. But in the absence of having that longitudinal data, we found that the 5 by 5 offered fantastic comparison. So even just doing the dipstick report, we could go and we can look at provincially how are our learners doing compared to the provincial average. You can go even with the 5 by 5 report a little bit more nuanced as well. So in terms of outcomes, yes, we performed better than the like kind of the provincial and the national averages, but our value was really in terms of trying to understand context-specific outcomes, and that offered a very valuable comparison.
Okay.
Thanks, Zani. Kitso, I just wanted to know if you had anything to add, particularly on Nirad's question around parents and engaging parents in the data.
Yeah, I just wanted to add on Nyarazo's how do parents process the results? I think as Zani was saying, in most cases, we will rely on learner assessment tools. And I think also the relationship that we actually have with our parents, we also empower them or capacitate their knowledge in terms of understanding the terminology, as she was saying that it might be very difficult. But we have a program, a caregiver program, where each and every parent that has a child in our program goes through the program, and we actually empower them to understand the importance of ECD and what are the different developmental domains that kids actually has to go through for them to thrive. So for that, it make it easy for them when the ELOM results come back, and then we present to parents. They have a better understanding what we speaking about. Thanks.
Thanks, Kitso. There is a question from Nazia about adapting the tools in different contexts. Nazia, would you like to ask your question?
Sure, thank you. Yes, I just would like to understand the scope of the adaptation of this tool, that whether it could be contextualized in other contexts. We have like programs like in East Africa, in Asia. So I was just wondering whether there are scopes of adaptation. And already in the chat, I saw that probably this training are only provided in South Africa. So I was just wondering whether there are scopes of any online training and any partnership in case anybody is interested to attend this training. Thank you.
Thank you. Thanks. I'd like to ask Liz if you can pop in and speak about current projects that we've been running in terms of using the data, the ELOM tools in other countries. That would be great.
Sure. Hello, lovely to get your question, Nazia. The ELOM 4 and 5 tool here, and all the ELOM tools are South African specific. So they've been built and developed with the South African curriculum in mind. It speaks to the developmental expectations of the curriculum framework and all those things. And so that's why they're very much South African tools. That said, we in the process, and we are open to adapting tools for different contexts. So, for example, we are working with the Ministry of Education and Training in Eswatini to make sure that they have a tool which is quite similar to the ELOM tools in lots of different ways, but that speaks specifically to their curriculum priorities and everything like that. So yes, they can be adapted. It becomes a whole different tool. These tools have been validated and standardized on South African populations, and that's what we're working with. But yes, they can be adapted to different contexts. Within South Africa, they can be used across the board. So whatever background, whatever home environment, wherever the children come from, the tools can be used, and for that reason, they're translated into all South African languages because they need to be administered in the home language of the child. I hope that answers the question.
Thank you. Just a follow-up question on that whether these tools are available anywhere. So if anyone could see that and want to adopt it in a other particular context, if there are opportunities.
Sure. I'm not sure I quite understand the question, but perhaps we could continue this. You could just share your email address and we can connect via that way, perhaps.
Yeah, sure. Thank you.
Or maybe ask it again.
Yeah. No, I wanted to understand whether this tool is available anywhere, that anyone from other contexts can actually see that and adopt it in the specific context. So the tool is available in any of your website or anywhere that we could see and then probably adapt it in a particular context. Because you said that yes, it's specific to any particular context about the learning, probably assessment and all those. But I was wondering that those learning assessment could be translated into specific contexts and could be adapted in other contexts. I mean the tool itself. if it's available anywhere.
Yeah, so Nazia, it's an open access tool, but to use it, you need to be a trained and accredited assessor. Let's continue this conversation off this webinar, and we can touch base exactly how best to go about doing that.
Thank you so much. That's
okay, no problem.
Wonderful. Thank you.
Thank you, Liz. There aren't any other questions I can see in the chat, so I'm going to ask one to both of our speakers from myself in the meantime. I'm particularly interested in, so obviously you've talked about both of you used the ELOM 4 and 5 as outcome measurements of your children's early learning outcomes. Was there any implementation data or any other programmatic data that you found particularly helpful to understand your child outcomes that were measured using the ELOM 4 and 5?
You mean, sorry, programmatic data in support of the findings to better understand why the findings, or
Yeah.
So we, as I mentioned, we had a dipstick report, which was really like I think it's like almost like the entry level in terms of analysis that we can find. So the biggest understandings came from having, how are we doing in each domain? We did have one domain in comparison with the other domains. We had one domain where we scored lower than, if you had to do a graph, it would go like not that extreme, but there was a little bit of a different extreme. So yes, we then found, and because again, going to our theory of change, and because we have this very rich programmatic data and monitoring in the first 24 months, we understand also where the causal pathways are, and we could go into that specific programmatic data. What is interesting though, and with these findings already, is sometimes you have to dig a little bit deeper. So we started off and we looked at what is the program offering that feeds into the specific, data. And then we also looked at, and this is kind of rather new, at our learner assessment and how our learner assessment assesses that specific domain. And we actually, the interesting finding, and this is still very new, so I'm not going to be able to speak in too much specifics, but it does seem that we actually need to tighten our learner assessment in that particular domain, and that is, we are busy working with Jet to do that, if we want to drive impact towards improving the outcomes of that domain rather than just changing the program.
That's really fascinating. Thanks, Zani. Kitso, do you have anything to add? I know you talked about your fine motor findings being lower than all the other domains. Was there any kind of deeper dives or any other kind of implementation data or qualitative data that you used to understand what was going on there?
I think for us, just one of the things that when the results came, or actually before the results came, so when the study was starting, I actually went out with the assessors, and there were already gaps that I, not being an assessor, I was able to identify as they were conducting the study. So one of the things that I noted, and I even discussed with Elizabeth, was that for us particularly, we never really had timed activities. So that was one of the sort of an eye-opener for us to say threading can actually be a timed activity, but we've always opened activities, and that has made us to have an assumption that all our kids are actually at the same level of performance. And then the other input, I think, that we reflected on after we got the results was going back to the practitioner self-assessment together with our learner assessment results to compare as to how vast is the differences between the two results and how we can best bring them together into synergy. So those are the things that we are still busy working on to ensure that we have a consistent process going forward. Thanks.
Thanks, Kitso. It really strikes me how both organizations have their own kind of internal forms of child assessments that the ELOM 4 and 5 has been used to validate, and how it looks like in both situations you've kind of compared the data, and it sounds like in the case of Zani, what you've described, that the ELOM data help to identify gaps in your internal measurement tool. And it's also interesting for me as someone who's worked with the ELOM in various ways over many years, but mostly in the context of evaluation, how I've just lost my train of thought. How it's a very useful evaluation tool. And Zani, you've depicted that really nicely with your theory of change, that it's great to measure kind of these bigger, longer term child outcomes, but that it's a lot more difficult to integrate as a monitoring tool on a more frequent basis because of the logistical costs and organizing assessors and all that. So that's personally a really great learning for me. Are there any other questions from the audience before we wrap up to our speakers?
I have a question. Hi, sorry. Hi everyone. I just wanted to ask, I know that LETCEE, for example, is going to be doing another ELOM assessment next year or later in the year, but I wonder if you've used some of the other tools. So the ELOM 4 and 5 and the ELOM R are child outcome assessments, and those are focused specifically on children, but we've also got the learning program quality assessment tool, the home learning environment tool, which are not child outcome, which are more the LPQA is more observational, and the HLE is an interview with caregivers. If you've ever used any of the other tools and how those complemented your M&E.
Awesome. So I'm happy to go first. We have used both in addition to the 4 to 5 year assessment. We've also used the LPQA previously, and we've used the socio-emotional rating scale. So in terms of the LPQA, actually, I really enjoy the tool. It is not sufficient though for us. So again, going back to our theory of change, where we do believe also, or we work very hard towards creating sustainable centers. So for us, we needed something that was a little bit more comprehensive than the LPQA. And we are in the process also of refining our own organizational assessment tool, which is called the STAR assessment, which feeds into a lot of, like, again, our first 24 months and monitoring that. I do think, though, there is a lot of value with the LPQA, and I do think it's for organizations that do not have necessarily the resources that we have in terms of monitoring and evaluation and the systematic support to enable that. It is a very good tool. I enjoyed and this is just because of my personal interest, the socio-emotional rating scale. We added it on to our assessment last year just out of interest, and we got some really great insight and like affirmations to us. We all have seen, we know the research and what a big driver that is. It is something that we are toying with to potentially include on a more regular basis, just because it is such an important kind of component of driving outcomes for children.
Thanks.
Thank you.
Thanks. We've just got 5 minutes, and I just want to highlight this question from Zihlukusle about what would you do differently? And maybe Kitso, we can end off with you. I think that's a really nice learning question for planning ELOM studies.
Okay. For us, we have only used the 4 and 5. We haven't used other tools, but one of the things that we just learned was the Grade R tools that are now available, because like for instance, when we did the ELOM 4 and 5 last year, the kids that were assessed have actually progressed to grade R. So it is not possible for us, for those who are not on track, to monitor or to even follow up as to how are they doing in grade R. But I guess now that there is a tool that can actually be used, that will be very valuable for us to be able to track those kids into grade R. Yeah. But in terms of what is it that we would do differently going forward? Number one, as I explained, for us, the first thing that we want to do differently is to use external assessors to eliminate or decrease bias in our data and results. And also maybe to also have more time in terms of doing the study and not doing it in a rush. Those are the two main things for us that we going to improve on. Thanks.
Thanks, Kitso. Zani, do you want to give us like one last quick nugget, one thing you would do differently, and then we'll close?
I think we've made we've shared our mistakes is like, and if for us, I just want to emphasize for us as Grow ECD and our theory of change, we couldn't integrate the data drive tools, that whole tool set, into our first 24 months. But I do think if there are organizations who think that, you know, this could potentially be helpful, it would be very valuable to speak to the team, because our learning was just because it didn't work in that specific 24 context, it did work in 36 months. So it's find the context where it can work for you and the best tool for that purpose.
Thanks, Zani. Thank you. Thank you both so much for your presentations, and thank you everyone for joining us today. I hope it's been helpful. And yeah, just to reiterate that the Data Drive team is here to answer any questions and to help you plan ELOM studies and talk through how you can integrate ELOM data into your MEL systems and your larger scale evaluations. So thank you again for joining this month's webinar. We'll be taking a bit of a break in the our ELOM in Practice webinar series for the school holidays and also the lead up to the Thrive by 5 launch. So our next webinar will be in mid-September, and we'll specifically be looking at measuring program quality using the ELOM LPQA tool, which Rumbi and Zani briefly spoke about here. So please keep an eye out for those details when they become available. And just one quick last reminder to please complete the Google form. We'd really, really value your feedback. And yeah, if you could do that before you leave. Thank you so much. Thank you for joining us, and we'll see you again in September.